Welcome dear friends. In Pharmaceutical Chemistry 2, today we are going to deal with anticholinergic drugs or parasympatholytic drugs. Myself Mrs. Urmila Ravindra Gowdi, M.Pharm in Quality Assurance. Anticholinergics. This drug which inhibit the pharmacological effect of acetylcholine liberated from parasympathetic postganglionic nerve ending are known as anticholinergic or parasympatholytic or cholinolytic drugs. The anticholinergic drug which inhibit muscarinic action of the acetylcholine are called antimuscarinic drug. The antimuscarinic drug have some structural similarity with acetylcholine, but it contains some additional substituents. They may be represented by this structure, in which R1 and R2 are the bulkier group like phenyl, cycloalkyl, heterocyclic ring. Alkyl group is a 2-carbon chain, or it may be form a cyclic structure with nitrogen, that is amino functional group. Depending upon X and Y, the classes of anticholinergic drugs are depends. Let's start with classification. Depending upon X and Y substituents, the antimuscarinic agents are classified as follows. Class first, amino alcohol ester, that again divided into solanous alkaloids and synthetic analog and synthetic compound. In amino alcohol ester, the X group is C double bond OOH, that means ester group is present, and at Y position tertiary carbon is present. For example, atropine, hyoscyamin, and from synthetic compound the example is propanthyline. Next class, amino alcohol ester, in which X is oxygen and at Y position it has carbon, and the example is benzotropine. Next class, amino alcohols, in which X group is X substituency is absent and at Y it has COH, for example bipyridine. Then next class, amino amides, in which X substituent is absent and at Y it has CONH2, carboxyamide group, for example tropicamide. Then next class, miscellaneous, in which X is absent and at Y it has nitrogen, for example pyrenzipine, ethopropazine. Papaverine and its synthetic analog are mainly used as antispasmodic and are not actually parasympatholytic drugs. Now see, what is the therapeutic uses of anticholinergic drugs? First, the antimuscarinic agents are clinically useful due to their antispasmodic, that means to lower the tone of smooth muscle effect, and antisecretory effect, and mydriatic and cyclophagic effect. Let's start with one by one. First, due to antispasmodic effect, they are used to treat renal and biliary colic. Then bronchial asthma due to bronchial spasm, irritable bowel syndrome, for example spastic colitis and esophageal spasm. Then nausea during motion sickness. Then next, due to antisecretory effect, they are used as anesthetic pre-medication because they inhibit excessive bronchial and salivary secretion and also prevent bronchospasm due to antispasmodic effect, and it is used to treat rhinitis and hay fever. Then third use, due to their antispasmodic and antisecretory property, they reduces secretion of gastric juice including hydrochloric acid. Hence they reduces stomach movement and hence they are used to reduce pain in ulcerative colitis in peptic and duodenal ulcerative conditions. And next use, due to their mydriatic and cyclophagic effect, they are used in ophthalmoscopy. Then atropine and other anticholinergic drugs are also used to treat Parkinsonism, that means paralysis agitans, and to reduce extrapyramidal symptoms, as they penetrate the blood-brain barrier and blocks the CNS effect of acetylcholine. Then anticholinergic drugs can also be used to treat poisoning by organophosphorus compounds, that means insecticides, which combine with acetylcholine esterase and causing accumulation of acetylcholine. Thank you for watching this video.